apart from the bleeding that women have during their menstrual periods, they also experience a lot of other things. For example, you could be having a headache or a backache at the moment, probably because you're on your menstrual periods and you don't even realize that it's due to your menstrual periods. Well, in this video, I will be talking about the changes that take place in the different stages of the menstrual cycle. So at least you understand what's going on in your body as far as the menstrual cycle is concerned. So stick with me, let's talk about this. Hello and welcome to Case Corner. My name is Karen and on this channel I talk all about menstrual periods. So the menstrual cycle occurs in stages, actually 4 stages, which are really linked to each other, brought about by hormones. And during these different stages of the menstrual cycle, women experience different kinds of things. Not every woman will experience every of these things, but just to note that these things are not intentional. It's just hormones bringing up a lot of changes, sometimes that the women understand, sometimes we do not understand, but these are changes that we go through. So let's jump in. The first stage in the menstrual cycle is called the menstrual phase. So this is the one that we all know, this is what we actually experience. It's the menstrual period. And some women will have it for 3 days, for 7 days, others would have for 10 days. Now, during that period, you're bleeding. That's clear, you're bleeding. But apart from that bleeding, you could also have some things like, say, headaches. And these headaches are usually more serious in the hot weather. So in the summer, for example, or in the dry season, for example, you really have bad headaches during your menstrual period. You could also experience an abdominal pain. So the cramps, the abdominal cramps which you experience during your menstrual period, usually it's manageable, it's tolerable. So you can do your stuff, you can go to school, you can go to work, do your normal house chores, and it's really not a problem. So women are usually aware. They know that, all right, I'm on my period and I have this menstrual pain, yet I'm carrying out my activities. It doesn't really stop them from doing stuff. However, if you're experiencing the pain that just makes you not do anything, it really just crumbles you. You can't go to school anymore. You can't do your normal house chores. You can't go shopping or do anything which you want to do. Then that's a red flag and you need to go to hospital for that. Then there's also the waist pain. You actually feel like you're carrying a weight on your waist. I do not know if you've experienced this before, but that pain, it just feels like there's something around your waist that is tied to your waist. It's your menstrual period, and because of hormonal activity, you experience that. Then there's the backache as well. So the waist pain and the backache usually go together. So you really just feel pain in the back there. Then there's facial breakouts, which is a common thing when women have their menstrual periods. Usually not the whole face, just, spotted here and there, quite painful. And many times you don't need to do much about it. It just goes away as the menstrual period is kind of finishing as well. And then because you're bleeding, obviously, and then with headache, you get tired. So there's also the tiredness, which women would feel. Some women have this abdominal bloating. So it's a feeling as if you've eaten too much and you feel like your stomach is really bulged there. But most of the time, you haven't really eaten more than you normally eat. Or sometimes you haven't even eaten anything. But you just feel that bulging of your stomach. And you really feel it most of the time when you're trying to put on some clothes. These are clothes which normally fit. And then you try putting them during your menstrual period. There's a little bit of it's a bit tight there, just a little tiny bit tight, manageable, but you just think something is going on here. All right, so that's usually because of your menstrual period. After your menstrual period, trust me, your stomach just goes down. So not to worry about it because it will go down after your menstrual period. These things will clear up. Then there's the irritability and mood swings. So it just means that sometimes you just get angry, you just get easily provoked, and at the slightest provocation, you just can't take it. Things which you normally are patient with, and then things that you can normally tolerate, they just get you on your nerves. All right. And then at the same time, you could get overly excited about something and you're really just so happy and so jumpy. The very next minute, something has just happened and you just switch. So it's mood swings. And again, there's hormonal activity. So you would have those changes. Bear with yourself and every other person to bear with you, because it's your menstrual period. It will clear up. The second stage is the follicular phase. Now, the follicular phase is kind of the resting period. It's the good period, in the sense that your menses has finished, your menstruation has finished, you're off your periods. It's that 1 week following your period. So if your periods are like, say, 5 days, it's the days following that, the 5th day onward. And if it's like, say, 10 days for those women who bleed longer, it's from day 11 up to about day 16, 17, and even 18 for women who have longer periods. All the things which you're experiencing in the menstrual phase or your menstrual period have now cleared up, So the breakouts are no more there. You don't have any waist pain anymore. You don't have the backache. You're feeling like yourself. So it's kind of the resting phase. And usually you look at women at this time, they're sparkly. They're looking all nice and neat. I mean, you look at the face, it's all shiny. It's really a nice time in the cycle. However, don't be fooled. There's a lot of hormonal activity still going on. All right. So, but in terms of what we experience in the body, it's kind of settled and kind of nice. And another thing during this phase is that sometimes for some women, sexual drive is on the rise as well, because of the hormone estrogen, which is also on the rise. But overall, thumbs up to the follicular phase. It's a good period. The third phase is ovulation. So ovulation brings the end of the second phase and obviously starts the third phase. So ovulation doesn't really last long. It's about 24 hours. But in terms of knowing the period or just thinking about the period where it will happen, usually you have like day 12 to day 18. Now, when you hear that or when you read that, it doesn't mean that ovulation starts from day 12 and ends on day 18. It just means that that period is the most likely period where you have your ovulation. But then to be more specific, or to at least know when your ovulation is happening, there are some key things that will happen to your body. The first one is a sharp pain. You feel that sharp pain on the side where the ovary is releasing the egg. All right. So if it's the right side that is ovulating, or the right ovary that is ovulating, you feel that pain on the right side and you feel it radiating toward the left. And if it is a left ovary that is ovulating, you feel that pain on the left side, it will be radiating toward the right. It's not a pain that lasts all day, usually a few hours, and it clears up by itself. You normally don't need any medication for it, but you are aware, you know that there's something happening. You're fully aware that something is happening in my lower abdomen, but you know, it doesn't stop you from doing whatever you're doing. Next one is a slight increase in temperature. This is a little bit tricky if you've not been monitoring your temperature, because you don't really get to know when the temperature is increasing. But you usually just feel a bit warm. Just, when you touch yourself, just a tiny bit warmer than usual. If you have any disease process going on that normally raises your temperature, or that's already raising your temperature, this may be a bit tricky, because you do not know whether this rise in temperature is related to the disease which you're having, or it's your ovulation. But generally, just in case you've been monitoring your temperature, you just find like a 0.1, 0.2, just a slight increase there. And then you have facial breakouts. Facial breakouts is really very common in ovulation. And again, just like in the menstrual period, it's just 1 or 2, not a lot. But I'm telling you, they are painful. They are really painful. Like just one bulging there and it's just poking through your face there, and you're wondering, why on earth is this pimple standing only here? Why could it not go somewhere which is kind of hidden, So it's just standing there, just poking there like that. All right. And usually you don't want to do anything about it. It will clear up. And then you also have, for some women, they have like their breasts get a bit tender, but also increase in size. So they feel a little bit of pain around their breast area, but they also feel tingling, a tingling sensation inside the nipples. Now, another sign which I want to really call key, really key sign here, in addition to all of these ones, is the vaginal secretion during the time when you're ovulating. And the best way I'm going to describe that is a raw egg white. So when you go to use the toilet, for example, say to have a wee, to pass urine, and you clean yourself and you look on the tissue, you have this transparent, slimy discharge, which you find on the tissue. When you put that together with the fact that on that same day or just about that same time, you have this sharp abdominal pain and then that increase in temperature or facial breakouts, you might be right. Most of the time, you are right to think that ovulation is taking place. You're actually ovulating. So these are the signs and these are the things which will happen to your body when you're ovulating. If you're having any value from this video so far, please like the video and share it. And why not consider subscribing to the channel and also hitting that notification bell so that you do not miss any of these videos when I upload them. The fourth stage in the menstrual cycle is called the luteal phase. Now, this is the phase after ovulation. So you felt all of these things after ovulation, and now you're waiting for your menses to start or your periods to start. So it's the period leading up to your menstrual periods. And usually the changes that women experience, most of them happen during this period. And it's actually those changes in this period that are referred to as the premenstrual syndrome. All right, so a lot of things happen here because there's a lot of hormonal activity happening here. There's estrogen on the rise, there's progesterone on the rise. So quite a lot of things are happening here. Now, the first thing which women would usually experience during this time, again, is that abdominal bloating, right? So I already talked about that, how you feel like you've eaten a lot, but you really haven't eaten much. And then in this period, some women would crave food, some things that you have not even eaten for a long time, and you really don't have any business eating those things. But during that period, you just crave those foods and you really just want to eat them. Some women will put on weight during this time. There's a slight weight gain. It's not something massively noticeable. Like it's not like I've just put on so much weight. No. It's not like that. But you feel your clothes getting a bit tight during this period. So there's a little weight gain during this period. At this time as well, there's massive mood swings during this period. So A, you're irritable, B, you're excited, and it just switches like that. In 1 minute, you're so irritable, you just get so angry, you're screaming at everybody, and the next minute, you're all smiley and you're all excited, and we're thinking, who in the world is this? All right. There's also breast tenderness for some women. You would also have changes in the sexual drives during this period. Now, I just want to come back to these mood swings and just say that usually for women, when they are in the low side of the mood swing, it's also sadness and depression. And this is a time in the woman's cycle where, sometimes they just cry, and they can't really just put their finger on exactly what the problem is. But deep within them, they're so sad, depressed, and would really, really teary, just cry. And if you ask them, there's a lot of things going on in their mind. There's a lot of regrets for some reason. You just start thinking about your past. You're thinking about what you should have been that you are not. You're thinking about, just some negative thoughts flooding in your mind. Well, I just want to say here that these are hormones playing around. And please do not give into that. You are a very valuable woman. You are an asset to the society. You are beautiful. You are an achiever. You are strong. You are courageous. You are all of those good things. However, your hormones are playing around with you and telling you something else. So please do not give into that and do not believe that. And the proof of it is that in a few days, you'll have your menstrual period. And after your menstrual period, you're moving to the next phase and you're all back to normal. You just come back to normal without anything happening. So just to let you know that those things which come into your mind during this phase are not true. It's a phase and it will definitely pass. In the comment section, please tell me some other things which you experience either before your periods or after your periods that I've not mentioned. But also go ahead and watch this video which I've put here so you can understand all the hormonal changes that happen during the menstrual cycle. Thank you for watching. God bless you, and I'll see you in the next video.